Alright, I'm answering a forum post on bodybuilding.com forums by BDY user. The title is Lower Left Back Pain Returned After 1 Year. Okay, so after 1.5 years of non-strenuous back exercises, I have started with Starting Strength program. And I am on week 2, and 2 days back I lifted 100 pounds deadlift 1x5 as advised by my Excel spreadsheet. My form was wrong and I bent my back a little, and that most probably caused it, and my lower left back pain, which used to be there 1.5 years ago, has returned. It's only on the left side of my back, and it feels like some kind of muscle pain while standing up, walking, lifting laptop bag from the ground. I'm scared now. What should I do? Leave Starting Strength program, see a doc, any exercises to fix this permanently? I thought 1.5 years was enough to cure whatever back issue I had. Alright, BDY user, I'm going to have to give you a really good answer because I have a lot of experience with lower back pain personally and helping people with their back pain. I still have this issue. It comes and goes, but ever since learning a lot of different things and techniques to kind of help mitigate my problems, I'm able to now deadlift 445 pounds. Now, just so you know, I've been a personal trainer for 12 years and have a lot of education and experience, but I have not had a lot of personal experience with barbell lifts like Starting Strength. To be totally honest, I've only been doing like full barbell lifts, like full squats, full deadlifts, for probably consistently for about a year and a half. But of course, I've always bench pressed, did a lot of dumbbells, bodybuilding work. But you're 26 years old, you're 5'11", you're 165 pounds, and kind of thinking about the information you give, it's kind of a coincidence that your back pain's on your left side, because that's where my back pain is. Actually, it's kind of tight right now. I basically deadlifted 5 days this week and squatted 5 days this week. I have a pretty intense, high volume program, but I know how to mitigate it. So here's my advice. You need to learn how to move. And that's not something that can be learned on a YouTube video. It's not something I can explain to you in even a forum post. It's nothing I can even say in this video to tell you. You have to learn how to move better. You need to find a really good coach, personal trainer, physical therapist. It doesn't even matter who it is. I think you need to find a really good trainer that can teach you how to move better, because that's what it comes down to. If you really want to solve your problem, you'll look up some stuff. I really recommend you look up Kelly Starrett, or go to mobilitywod.com. A lot of his stuff has helped me greatly in my fitness, my own personal fitness, and has helped me help other clients. And I recommend him because I've had this lower back pain, hip impingement problem that I've had so much problem with that no one can solve. And why can no one solve my problem? Why can no doctor, chiropractor help me? Because I'm not dying. You know, when you're trying to improve your performance and get better at something, no one cares if you are in good condition. You have to be sick. You know, so if you're not in pain, or if you have to be basically broken or almost dying before you get any real help. No one really cares about you getting stronger in the sense of starting strength, because a lot of that stuff are advanced movements, or they require a lot of skill. And if you've been reading the book, you know that it has a lot of good technique. And if you read that, I mean, that's an awesome book by Mark Ribito. But I'm going to say, you need help learning how to move. Go to mobilitywod.com to take a look at some of Kelly Starrett's videos, or you can subscribe to his YouTube channel. You know, I'm just a trainer, and I've learned a lot of different things, and a lot of the stuff that I learned from him has helped me, and you might be able to find something there. And I wish you the best of luck. There is a way to get through this, and the one thing that you don't want to do is nothing. You want to get stronger. Do everything and anything possible to strengthen your body without getting hurt. Now, I'm not saying that you should stop starting strength. I think you need to learn how to move good. You need a good coach so that you can move better. But I really do think that what you really need is, or what would the approach that I would take based on the information I have from you in this forum post, is I would just say, why don't you go ahead and just start doing all the exercises you can to strengthen your body that doesn't give you any problems. If you have like for example, deadlifting, it's just a high risk exercise for you. I mean, it's a high skill exercise, which means it's a high risk. It's a high risk exercise for me, but because I've learned how to move really well, or move around my problem, I've been able to solve it. And I already know my biggest problem is lower body, because when I push my lower body hard, it gets really strong, but then also my hips and lower back tend to not move so well, which end up giving me problems. So anyways, I wish you the best of luck, BDY user.